Berry, who created a groundbreaking menopause platform called Respin. And here joining us is the Respin community coaches, Dr. Sarah De La Torre, Coach Monika Pierce, and Coach Jill Foos. And we're going to ask questions to the experts. Okay, the question we have is for Dr. Sarah. Where is Jen?
Right here.
Oh, hi, Jen.
Hi,
How are
Drew.
you?
Hi, ladies. I'm doing great, thanks. I am 54, and I've been in menopause for about 3 years now, and it unfortunately coincided around the time that I found my love of my life and got married. And right as we were in our honeymoon phase, like you, Halle, I started experiencing dryness. My doctor prescribed suppositories, which came with the lovely warning, don't have sex within 12 hours of inserting this, or else your husband's going to find some interesting side effects of his own. And I'm wondering, do you have solutions that can help with the dryness, but don't stop spontaneity and intimacy?
I do. So, first of all, congratulations.
I know. By the way, I was so excited when you were asking that question because I was like, they have things.
So, first of all, congratulations on your marriage. And also, I love hearing that you have an active sex life in menopause. I think it helps to dispel the myth that in menopause, sex is over, you know, you've lost your groove. So I'm really happy for you. And I'm also really happy to hear that you are using vaginal estrogen, because vaginal estrogen is the gold standard. It really does work. It's effective. And it's also safe for most women. But I have a few solutions for you. One may be the timing and the time of day when you use it. So a lot of women use estrogen at night, whether it's a cream or a suppository. If you try it in the morning, you know, the 12-hour thing is mainly for absorption. We really want that medicine absorbed before there's too much friction in the area. The other option, you maybe could try the ring. So there's an estrogen ring. And so you're not worried about the absorption. You're not worried about the exposure. It goes in your vagina, and it's local. It's not systemic.
And what does the ring do?
It's releasing estrogen slowly, and it lasts for 3 months. So you can, many of my patients put in there and leave it. And so it's a great option. And then there's wonderful non-hormonal solutions too. So hyaluronic acid, which we know is moisturizing for our face, is also very moisturizing for the vagina. And you can use that suppository. We have red light therapy, Halle.
That's the tool I want the guidance on because I'm dying to try it.
Okay, I'm going to tell you how to use it right now.
And I was like, look, I'm going to be the one who
No.
You know, blows it up.
No. This, Drew, is what changed my life. It wasn't the ring, it wasn't the estrogen. That's how I met Dr. Sarah right here, and how she became, on our board and our certified doctor, is because that was my problem and I was trying to solve for in the beginning. And I met with Dr. Sarah from Joy Lux, and they said, we have this V-Fit. It's a red light therapy device that you insert, and you do it like 10 minutes a day for about 2 weeks at first. And all you do, Drew, is you take it and you insert it.
Okay.
I did that. You put that in, you just lay back, do whatever you're going to do, scroll your phone, read something, call somebody, and in 10 minutes you take it out. And I would do that every morning for 2 weeks. In 2 weeks, the razor blades left. So then I went to Dr. Sarah and I said, hey, you know what I really need to create? Like, our first product for Respin needs to be an intimacy gel. She said, it must have hyaluronic acid, it must have aloe vera, all those things that make it clean. And then at Respin, we decided, let's put it in a beautiful bottle, not like a squeezy tube, but put it in a beautiful bottle that you would not mind putting on your nightstand, so that we can remind ourselves at this stage of life to actually have sex. I mean, we have to stay active. And so I keep this now by my nightstand, and I'm reminding myself at least 4 nights a week, I go, oh, I should use that. Look at that beautiful thing that's sitting on my...
4 nights a week. Nice.
Oh, we're back to 4 nights a week, and it's amazing.
Yes, this is what I got. I'm so excited. Okay.
It's called Let's Spin, and let me tell you, baby, you will be spinning. You will be spinning. You will. It's not just for women at this time of life. It's for anybody who wants to have sexual intimacy, enjoy their life, and take a spin. It's for anybody, right?
But I love take a spin. Really new meaning for me on spin.
Works for us.
And to know that you are providing these vital tools that we can all use in the comfort, privacy, and empowerment of our own home is just, it's miraculous. And I'm so grateful that you're making it accessible, attractive, and also just, I think the conversation we're having, we were talking about big, deep, stuff, and it just feels so light, It's like if we just bring the humor and the reality and like the casualness to these conversations, we won't make them taboo, and then we won't get into some type of shame spiral where we don't deal with things. By the way, you guys brought goodies.
We did.
Oh my God, I'm so excited. Okay, so I think we have the Let's Spin Intimacy Gel in the beautiful bottle. And then there's also a symptom tracker booklet. And then also a 3-month membership free to Respin Health for everyone here in the audience. As a last question, is there a reason, we talked about this at the break, but like I also don't feel like my brain is functioning like as awesome as it used to? Is that age? Is that menopause? Is that female? Why is my brain not working the same way? That's just the last question, because sometimes it concerns me, and sometimes I just write it off as part of the program.
It's estrogen. So we have estrogen receptors head to toe. And as we're getting into perimenopause, they're fluctuating like crazy. Progesterone's going down. And you get into menopause where you're really getting close to your siesta, where you're not going to have any more periods. You're in menopause.
The siesta. Yeah.
Then your estrogen's low and your brain does not function as well without estrogen. So it's the brain fog. Where are my keys? And also anxiety, mood changes, all that stuff.
Okay. Thank you, Halle, Dr. Sarah, Monika, and Jill. Thank you for illuminating us and having access to this type of profound platform. Respin, everybody. We'll be right back.